Hi guys, here again on behalf of our ladies to give an insight between the urinary tract infections and the yeast infection, or what we refer in other words, the vaginal candidiasis. One of my concern and something that I've noted, majority of women confuse between urinary tract infections and the yeast infection. Number one, the treatment is not the same, and the clinical presentations is not the same as well. All right. So anytime when you have yeast infection does not mean that you have urinary tract infections. And anytime when you have urinary tract infections, it does not mean that you have yeast infections. I will say that the clinical presentations of yeast infection, number one, it's when you have itching in your vaginal area. You have whitish vaginal discharge. You can also have some kind of lower abdominal pains. But the main presentations are the itching, some burning when you urinate, and the whitish vaginal discharge. That is the classical presentation. All those are the main symptoms that will make you realize that you are having a yeast infection and it's not urinary tract infection. In urinary tract infections, people present with low abdominal pains. They present with back pains, frequent urination. Anytime when you urinate, you just pass a little urine, and persistent need to keep on urinating, and also burning when you're urinating, or pain. When this condition is severe, it will also present with some blood in urine, but that can only be seen under microscope. Now my concern is here. Anytime when you have yeast infection, please avoid using antibiotics, because antibiotics, number one, they kills the bacteria. By killing the bacteria, they will cause an imbalance between yeast and the bacteria. So when you have yeast infection and you take antibiotics, what will happen is this yeast infection will become worse, because there will be an imbalance between the fungus and the bacteria. So instead of you healing, you will present with the more vaginal discharge, you present with more itching that will also make pain too much. So avoid antibiotic in yeast